Hi, welcome to Podiatry Practice Mastery. Don here. I've been having some struggles learning how to document wound care dressings and the kind of the wound care detail that's needed within Athena. So that's why I'm going to make this Athena, basically Athena Podiatry video for you if you use Athena. So basically, it doesn't really change the HPI or review of systems. I'm going to start with the physical exam. This is a new template that I'm putting here. Once again, all these templates you can get on the 30-day practice blueprint within the Athena section. This is the new one that I made because now we have to be much more detailed. So I'm going to give you an example of an ulcer, let's say on the left foot, and how I would do this documentation. So I only have one lesion. I guess if you're seeing, I'm usually seeing just one. It's usually not multiple. To do multiple, it would be a little bit more challenging. But I put this together. And once again, if you guys want my actual Athena stuff, you can just reach out to me at Don@Podiatry Practice Mastery, and then I give you my Athena code, and they can transfer some of these over to you. So this is a test patient. Let's say left foot. Let's say most of the times we see a diabetic foot ulcer. So I put in these selections here. Diabetic foot, is it a surgical wound, pressure ulcer, burn? Most of them I see are diabetic. Within the guidelines, they recommended when we're doing these dressings, I'm going to do an example of a collagen dressing. We have to do the ulcer length, width, and depth, and in centimeters. So the only pain to this is I have to put like 0.2 by 0.2 by, for example, by 0.2. So the only drawback is you have to do the 0.2 versus like millimeters. I thought about doing it centimeters and millimeters, and you could choose. But I guess for this type of documentation, they wanted all centimeters. That's why I chose this one. Tissue depth, is it dermis, subcutaneous, muscle fascia, or bone? Most of mine are subcutaneous. The ulcer stage. So once again, I know some of this might seem redundant, but they kind of wanted this as we were doing the training about doing these wound care products. So partial thickness versus full thickness. Most of them are full thickness. For like a collagen dressing, there has to be some type of a drainage. Otherwise, you can't use a collagen, right? You're going to use something else like a hydrogel or something else similar. So usually most of them are serous drainage. The drainage amount, once again, you have to have drainage. So if there's none, they're not going to, insurance might take it back. So mild to moderate is kind of what you need. It's not appropriate for heavy. So for heavy, you're going to use foam. So mild to moderate, let's say. I always include this because the drainage frequency needs to be daily. That they made us put that. The color, most of mine are clear. Odor is usually absent. I also included undermining or tunneling. So if most mine aren't, I guess, but let's say there is, you would just kind of say where. So you'd say what like 3 millimeters to the 1 o'clock position or something like that. Necrosis, no. Signs of infection, no. So if there is signs, you could put yes and what was the response to the treatment. And then I include here the ulcer, the location. Let's say it's the first met head, okay, which is a pretty common. I always like to put this in as well. So today I'm doing this. It began here in the initial size. If this was the first one I'm doing here, I'm going to say the initial size was that, and I'll put this down here. I like doing this because I can track it, so I can see when it actually began, because a lot of times we forget when things begin. So you can see them like a year later and it's still the same size, and you're thinking it's getting smaller. Here's an example of just one example of a collagen that we use here. Today I dispensed, and ours come in 15 packages or 15 gram packages. And I'm going to do each of these 15. They were given to the patient for a 15-day supply, and kind of explains all of this, the why. Okay, this is our dispensing note. You could also do this in your plan, and just put it in your actual note under the plan portion. We do that for certain other DME, and I'll show you that in a second. Also, then the debridement codes, because you're also debriding. So let's say left, type in first met head. Let's say we use a scalpel, the hyperkeratotic ring with devitalized tissue, subcutaneous tissue. So once again, 2 times 2 is 4, so it was like less than 1, so 1 centimeter. You have to multiply those numbers that you just put up top. and then kind of what I put on there today. Once again, you have to remember you cannot dispense and put on at the office. So I would be putting something else on, like a betadine, and they would do this collagen at home. So that's the first set. So that's kind of how you do the physical exam and the procedure of the debridement code. A little bit more in depth than I had before. So this was done by, they made the recommendation, the wound care company made the recommendation for this. This is my ulcer code for ulcer. This is the collagen that I'm giving them. So it says this is also an order that's in there. So dispensing 15-day kit, collagen powder, bordered gauze, normal gauze, and then a saline wound wash. All of that they get. The way I do it is I have them use the saline wound wash, spray a little bit that in the little packet with the collagen in that little package, and it makes it a little kind of like a paste, and they put that paste on the bottom of their foot daily. And then also here, this is the wound care note, so the macro. So once again, all of these I will put within the 30-day practice blueprint if you guys want them. Patients here for ulcer care. You have to put estimated duration. This is something new for me as well. So you kind of estimate, let's say it's going to take 4 months because stuff takes a lot longer than you expect, that they're going to need to see me. So usually what I do, if they're infected, I'll see them weekly or even quicker. If they're not infected, I might do it every 2 weeks. Potential to heal might be good. The wound status, if it's new, stable, or improving. So these are all the options that you can choose. The dressings that I recommended, in this case, it was a collagen. You could recommend something else. The frequency of dressing changes were daily. You would use, for example, if you did a foam, you could do it 2 to 3 times a week. Duration, once again, they want to know not only how long the ulcer is going to take to heal, but how long you're going to have to use these dressings. So I say about the same number unless, it's getting drier and there's no drainage. Offloading, kind of what you're doing. So surgical shoe, offloading shoe. And then I put these things underneath here, and I delete these if I don't need these. So it says here, due to infection, recommended antibiotic. Visiting nurse was or was not set up. Cultures were or were not done. ABIs were ordered. But if there's nothing, I just delete this section. So there's nothing. There were no signs of infection. And then I'll have the patient come back. So that's kind of how I do it for this patient. So it pulls in everything. I might send it to their office. And then this is how we do the DME through the office. Basically, we're billing for the collagen, the wound debridement, and then the office visit for that. And that's kind of how you do it. Once again, if you guys want all these, they're in the 30-day practice blueprint. There'll be a little link underneath this video to help you guys out. Okay, thanks.